Hi, my name is Dr. Rafael Gonzalez. I obtained my PhD from the University of California, Irvine. And since then, I've been working in the regenerative medicine sector. Approximately 20 years that I've been in that sector, in particular working with cells and stem cells more than anything else in the capacity of regenerating and repair and working with the immune system more than anything else. So a lot of people ask the simple question is, how do stem cells work and what can they treat, or therapeutically, what is available out there that they have a good chance to help? In that context, we discuss two different things of how stem cells work. One is we discuss the context of modulating the immune system, so maintaining the immune system in a healthy state. Stem cells have the capacity to regulate our immune system or modulate it. So basically putting, sometimes a person that's in a pro-inflammatory state into a regulated state by increasing the amount of anti-inflammatory T cells, or what's called the Th2 response in our body. This is actually done through a regulatory system that is increased once we use stem cells, which is called the regulatory T cell. This is the cell that basically regulates, surveils our body, and makes sure whenever there's any form of havoc, the immune system's out of whack, for instance, an autoimmune disease, we have to regulate it, suppress it, because what our bodies want more than anything else, and what stem cells help us do more than anything else, is put us in homeostasis, a healthy state of being well. When we discuss the context of using stem cells, we're not discussing the context of any form of cure. We're discussing that it can actually help your quality of life. For instance, a patient with an autoimmune disease, a history of rheumatoid arthritis, lupus, and there's a lot of publications out there on thousands of patients demonstrating that it regulates their immune system and it makes them feel better, and they can now live that proper quality of life. That's just one example of it. Examples such as, for instance, if we look at the other thing that we can actually do is increase blood flow. Stem cells secrete out specific growth factors such as vascular endothelial growth factor or platelet-derived growth factor that can actually help increase blood flow to the vital organs. When we discuss the context of that, why is that good? Think of this. When we lack blood flow to specific organs, we don't have the correct nutrients that go to those organs so we can heal and repair. We need that. Secondly, when we think in the context of disease, think of stroke, think of heart attack, peripheral artery disease, limb ischemia. These are things that if we use stem cells, and there's evidence out there that if we use stem cells, we can now regulate that immune system, increasing blood flow by forming new bridges of vasculature to the vital organs that were affected. We can help repair those particular organs that are affected, for instance, in stroke and heart attack, examples of such. One last thing that we can actually use this for, and it's used quite successful for, is think of this: wound care, healing of wounds. So a wound may be open, it may be infected. That brings in one part is, of course, the immune system. And secondarily to that is being able to increase blood flow to that area so that wound can heal quickly. It also brings in now the dynamics, if we think of it on the side too, of cosmetic possible applications where we can stimulate cell growth in the skin, we can stimulate vibrance, possibly in the skin, and stimulate, which has been shown in stem cells, collagen production, elastin production, hyaluronic acid production, that cells actually, believe it or not, these cells produce that. Cells have to produce all these different substances, and particularly in stem cells, to survive and do what they need to do.